All right, welcome everybody. We are starting our third session here for Career Day. And I have two amazing healthcare professionals here to share with you what they do. So we have Dr. Imes Hauser and Caroline Fitzpatrick. So Dr. Imes Hauser, you can go ahead and begin.
All right, thank you. So nice to see all of you here today. So I'm a naturopathic doctor, and you might be wondering what that is. So the word natural is in the first part of that. So we're about natural medicine. So trying to use plants, nutrition, kind of the lowest force we need to get the job done. So I work with the Puyallup tribe down in Tacoma. That's where I'm at today. And our clinic is called Quabil. And Quabil is a Lushootseed seed word that means to heal oneself in body, mind, and spirit. And that really encompasses naturopathic medicine as well. So we're looking for not just to take away symptoms, but actually treat the cause and look at the whole person, not just the whole person as well, but our environment and our families, because everything plays a role in our health. So a couple of things, and also in our clinic, I want to mention that we see patients here, but also we have a research center, and we work with WSU and UW on some different projects looking at medicinal plants. So a couple awesome things about being a naturopathic doctor. One is that you can be a doctor anywhere. So we learn about plants and we learn about plant families. So if I go somewhere else in the world, there's bound to be a cousin of the plant that I know here in the Seattle area that I can use as medicine. As well, and not just plants, but using your food, using water, hot and cold water can help to move blood, help move waste, things like that. So anywhere we go, we can kind of be dropped in and do some work and do some healing. The other thing I love is getting to solve mysteries and helping to identify what are the things our body is telling us and what does it mean. So in my training, we learn all of the anatomy and physiology, biochemistry, all of those, the hard sciences. But we also learn about herbal medicine and nutrition and exercise and how our mind and body are connected. So we're able then to take that hard science information and the evolving field of medical science and what we understand about it, and use some of the old ways along with the new ways to sort of get the best treatment possible. Now you'll speak with Caroline here. She'll speak to you in just a moment, and she works in a completely different kind of setting than I do, and both are important parts of the medical field. If someone were to come to my office, it wouldn't be for an emergency. It would be because they're working on maybe a chronic health problem and they're needing to get to the bottom of it. So I usually sit with people for about an hour. If someone needs emergency care, they're not in my scope. So I would send them to the ER. They'd see someone like Caroline to take care of them and help and solve that sort of a problem. So basically, being prepared is a lot about that. One of the things I enjoy about being a doctor, I was the kid that would have the emergency kit, the first aid kit, and we go on a bike ride. And once my brother skinned his knee, and I was right there with him to patch him up and give him a hug and make him feel better. Now, that sort of preparation, it was a part of who I am, and it blossomed a little bit more as I went into high school and realized that I really liked being prepared. I liked learning about the body. And as a runner, I was a cross-country athlete. I always wanted to know how I could feel at my best, be my best competitor and be at my best. So I learned that there was a branch of medicine called naturopathic medicine. And that was super interesting to me. I found out there was a school, and I actually lived in Texas at the time, but I learned that there was a school in Kenmore, Bastyr University, that was one of the top naturopathic schools in the world. So I went to school there. It took me 5 years to get through. And I really feel like after that education, I had a lot of, it really was what I was looking for as far as learning how to heal myself and to help others heal themselves as naturally as possible. So there's so much more to say, but I'm going to go ahead and let Caroline talk and then look forward to answering some questions.
Thank you, Dr. Imshauser. So as she said, I'm a nurse, and I know that it said clinical research nurse on the platform there that you saw our titles, and I actually have 3 jobs. So I work as a clinical research nurse, I work as an emergency department nurse, and then I work as an adjunct faculty at Bellevue College as a nursing instructor. So I'll talk a little bit about those, but first I want to talk about how I got into nursing, because although I feel like it was kind of a non-conventional way, what I've learned about nurses is that we come from a variety of backgrounds. I think the really cool thing about nursing is that it is really flexible and it allows for a good balance within family life as well. And so I think there's a lot of people that changed courses from a different career to get into nursing to have that balance. So I actually graduated from University of Washington with a finance and international business degree, so nothing related to nursing. And I worked at Boeing for 4 years, and I did project management, working with like construction projects, and I worked as a chief of staff for our non-production procurement. So nothing related to healthcare. And while I worked there, I decided that I really had wished that I had something more balanced, that inflexible and part-time, because we were just starting to have our family, as well as I really regretted my decision to not go into the medical field. I had thought about being a doctor in high school and kind of got discouraged with the length of time of schooling, as well as the competitiveness. I really wanted to go to University of Washington, and a lot of people were like, oh no, unless you have a complete 4.0 and this and that, you're never going to get in. So I was a little discouraged by that and went into a different field, but quickly realized that it wasn't too late and that I could change course. So I went back to school when I was actually pregnant with our 3rd kiddo. And so I had a kiddo during nursing school and graduated in, 2014 now, I think, and started working in the emergency department right afterwards. So I worked there for a year full time and then was able to go part time for our family balance. And then within the last year, I started working as a research nurse and nursing instructor. So emergency department nurse, what that entails, you go to the emergency department when you think you have something life-threatening going on, right? And so our job is to decide, how sick are you? Is there something that needs to be dealt with right now? Or is it something that, you're pretty sick, you need to be in the hospital while we figure things out, or we know what treatment you need? Or can you go, work on this problem outside of the hospital system with your naturopath doctor, your primary care, your pediatrician? Okay. As a research nurse, I've been working with a team. They do a variety of research projects and to develop new technologies in medicine in terms of some therapeutics with medicine, and then some actual medicine, and some with more of health technologies. So like for instance, one of the things they were looking at, it's kind of an interesting, it's a little machine that someone had tested that they thought they could decide if you had COVID by looking at the back of your throat. And so they programmed this machine and they would take a picture of the back of your throat and then they would test it with like actual tests to see if you had that. So I didn't work on that one, but that's an example of how they would test technology to see if it could be helpful in medicine. What I worked on was monoclonal antibodies. So I helped infuse monoclonal antibodies into COVID positive patients to help develop treatments to treat people and make sure that they wouldn't end up in the hospital severely ill. So it was a double-blind study. And what that means is that we didn't know if the drug they were receiving was actually the drug, the monoclonal antibodies, or if it was normal saline, basically salty water, which is called a placebo, right? And then we tracked them for 90 days, doing blood draws, tracking their symptoms, doing swabs to see if they still tested positive and for how long and how well they improved. And then monoclonal antibodies are antibodies that were made in a lab. So they're not developed, they're not from human. They didn't take blood from someone and then infuse them into somebody else who's recovered. It was just lab developed. So that's a little bit about all the roles that I've done. What I like the most about nursing is the flexibility. So if I get bored of something, I can move on and try a different field. So in my nursing instructor job, I've been working with pediatric students or nursing students in the pediatric field. So I've been at children's the last quarter. So that's been a really great experience working with kids primarily, and adult learners. So I've really loved that nursing allows flexibility for me in learning and growth as well. So I think that's my 5 minutes. And now we turn it over to you guys to ask questions. So if you guys want to ask, type questions in the chat, both of us will answer them.
Unmute myself. JD, I like your question there. What are some common characteristics of healing plants of poisonous plants? Okay, so sometimes I just want to say this. Sometimes the most medicinal plants are guarding their medicine with lots of protections, like Devil's Club, for example. It's something you can find in the forest here. It has really big spikes on it and really big leaves. When you come across it, you can't miss it. But it protects its medicine. Basically, you'll find healing plants in places you need them. So with nettles, you'll find plantain. Nettles have that stingy aspect to them. It can stick around for a while if you brush up against one. But plantains often grow by nettle, and plantains are a leafy, they're kind of like a oval leaf that, and I'm not telling you this so you go identify it. You need to make sure you identify your plants perfectly before you take them in. But basically, the plantain can help with a nettle sting. You chew up a little plantain, put it on the nettle. Okay, I'll let you, Caroline, answer. Hardest part of being a nurse?
And for me, probably the long hours. Sometimes the 12-hour shifts can be pretty exhausting when we're short-staffed in the hospital system. So that's another reason why I like working in a variety of different roles, because it allows me to not get burnt out in one, because it can be very different working in a hospital system versus not a hospital system.
What plants do you use the most? That's a good question. I think what's seasonal, because again, plants come around when we need them. So right now we're starting to get nettles, lemon balm. Those are plants that are growing right now, and they both have characteristics that help with allergies. We've got a lot of pollens in the air. So I guess the answer to that is what's needed and what I know. And also plants have sort of a signature to them. They have like a mental, emotional picture. So I try to match that with my patient. Naturopathy and is that homeopathy maybe? Nia? I think. If that is homeopathy is something we do study in naturopathic medicine. It's the idea that like cures like. And I'd say it's a branch, but it's not the same as naturopathy. Naturopathy is more broad. It's more about our principles, our philosophy, applying and using the lowest force to get the job done. 9 years of school for me, it sounds like as well. Caroline, you had about 9 years.
Yeah, I although I've had 9 years of college, I didn't need 9 years to become a nurse. So you can get an associate's degree in nursing and become a registered nurse in 2 years. You can get a bachelor's degree in nursing, and you become a registered nurse, and that's 4 years. A lot of the hospitals require now bachelor's degrees. And then I went on and got my master's, which was another 3 years. I like that. What's the most rewarding part of your job? For me, there's a couple. That's kind of twofold. So I love working with patients. It can be really difficult sometimes, but what I really like is in an emergency setting, making someone feel really comfortable and being able to see them. We don't always know what's going on, but still being able to provide care where someone feels comfortable and safe. And it's a crisis. They're there because they're having an emergency, whatever their emergency is. So seeing how people progress through that is really rewarding. And then now taking that a step further as a nursing instructor, being able to be a part of new nurses' careers and watching them take off and how they interact with people and how they understand their biases. That's a huge piece that I really love working with nursing students with.
As far as Katja, you asked if we work alone. I do work alone. I have staff that support me, but I am a solo doc in practice. Natural first aid kit. Ooh, I like that. Yeah, so there's lots of things I put in there. I feel like that would probably be best to talk about further, but there's some very simple things you can have. Yeah, I really like that question. I just don't feel like I can give it the airtime it needs on this forum. Maybe we'll have to have something more in that regard to talk about that. Most rewarding part, I really love seeing the light in people's eyes when they understand what they're experiencing and how, and they feel empowered to take care of themselves. I want to put myself out of a job with people. I want people to feel like they know, I want my patients to feel like they know what's going on and they can know what to do for themselves. So I love seeing that. Dandelions, absolutely. Dandelion are such a much maligned medicine, really. They're everywhere, so good, and especially in the springtime. The leaves are used, the root is used, and the flowers are fun too, to do things with.
Most common way to get your medicine into a patient's system. We use all of them, or I do. So intramuscular would be shots through their muscle. Subcutaneous would be through the subcutaneous tissue. So someone that is diabetic that needs insulin is going to get subcutaneous. So it's not going to go into their muscle. It's going to go into their tissue to get that. We use intravenous, which is through an IV. So, you know, a needle goes into your vein, and then the needle comes out and a catheter stays in, and we use that to give medicines. And then orally as well. So probably the most efficient way was orally. It just takes a little bit longer. So a lot of times in an emergency setting, we'll use intravenous to get things like pain under control in the immediate, or life-saving measures. We definitely use that. We also use intraosseous, which is in through their bone. So in a situation where we can't establish vascular access, they drill into someone's bone, because you have through the marrow there, you can give medicines to be able to sustain life if needed.
And on the other end of that, I'll say on the like lower force end, a lot of the ways that I use, so baths, inhalations, teas, tinctures, which are either alcohol or gluten-based herbal preparations. There's so many different ways that we can get medicine into someone. I also do IV nutrients, so like B vitamins, vitamin C, multivitamins through the veins, as well as in the muscle in an injectable form. So, but it's a fully different sort of practice. But yeah, lots of ways to get medicines in. And the skin is actually such a great way. It's got a lot of real estate.
Yeah, we do a lot of topical applications as well.
Mm-hmm. I see any plants that could help with COVID symptoms. Certainly for symptoms, absolutely. You know, a lot of our herbs that help with the breathing, that help with our immune system, can also be helpful for any sort of viral process. So yeah.
Okay, we have about 2 minutes left.
COVID treated with naturopathy. That one is a tricky one. I will say that has not been established. We don't have anything that says that, you know, specific treatments naturopathically are treating COVID. But again, a lot of the same processes or same medicines we'd use to treat a virus, especially someone who has a chronic virus going on. But even just acutely, yeah, we would do those same sorts of things, and then be able to recognize if it's out of our scope and we need to refer on. And that, I just want to highlight that, because that's very important. Because people can get very fixed on wanting to do just natural medicine, and really we have all of the breadth of medicine available to us. So we use what matches.
Yeah, and you guys are asking a lot of great questions about like treatments of things. And I think it's really important to look at the fields too, of like, there's a whole research field that is like, they go and they do these studies, right? So it's not just like a one-time thing. What might work in one case might not necessarily be evidence-based, right? So you have to have enough of a sample size, enough people enrolled in a study, and you have to make sure they're all doing the same thing. So, because what if someone else used something else and that was actually what fixed it, right? So there's a lot of energy and time and money that go into developing these research studies to determine what is effective in treatments, even in naturopathic medicine as well.
Definitely. I see a couple of questions about honey can be useful. I'm guessing that's related to virus or hot stuff. I mean, there are lots of things we can do just in our daily life to keep ourselves well. And I think that that's where, food-based medicine comes in. When we start getting into a disease process where our immune system gets revved up, we start having a fever, we want to support those processes as long as it's not putting us at risk. So there's a certain line where, we need to have a higher force intervention. But yeah, absolutely. Using your daily things you eat, eating hot foods, eating fermented foods can generally be a good thing for people.
All right. And this brings us to the end of our session. So everybody say thank you very much to our presenters, and you can move on to the fourth session.